Hi, good evening, friends. I am Dr. Mahesh Nair, once again back with my YouTube live. I know I've not been doing an Insta live for quite some time now. I'm just exploring whether a YouTube live works good to reach you guys or whether an Insta live works. So let me see and give me a feedback as to whether an Insta live is better or YouTube live is better. Whatever is convenient for you people, we can do it that way, not an issue. So I'm, as you all know, the director and founder of Nepantag Aesthetics, and my clinic is in Panampally Nagar, Cochin. And today's topic was suggested to me by a patient, not exactly a patient, an acquaintance or a client of mine who suggested me this topic. And it was basically just thigh lipo, but or thigh lift. But then I thought of combining everything and making it a session on, say, thigh contouring. So what does thigh contouring mean? That it involves the whole ambit, right from say the liposuction, the thigh lift, thigh contouring. All your doubts can be sorted out over here, including the most sought after question, that is cellulite in the thighs, because that is one region in the body where cellulite accumulates, and it looks a little unsightly, of course, the dimpled perdorage, like an orange skin appearance. So let's begin with this. And I have a few questions which I gathered over the week from my other, patients or clients or well-wishers or whatever it is. So let's try to answer all of them. So when it comes to thigh contouring, what are we looking at over here? Thigh is a very uniquely designed, what I can say, region of your body. It is just like the arm, but at least the arm is limited. Thigh has a lot of muscle, thigh has fat, and thigh has big bones. Okay, so the thigh is something like a conical cylinder. Okay, it's like a conical cylinder. It's narrow or tapering downwards. It's a little broader on the upper side, and it is still cylindrical. And moreover, it is not just uniform. It is different at different places. As it goes down, it narrows. It needs a certain kind of a look. It needs to look chiseled. It cannot just look like a pole standing there. That will look very unsightly. So yes, thighs, luckily they are quite, what I can say, hidden or concealed, because be it Western culture or our culture, mostly thighs are generally covered by the clothing that most of the cultures world over they wear. So except, like, yeah, if you are in Miami and you're always on the beach, or you're in Brazil or something where carnivals and all are a part of your life, then yes, thighs are going to get exposed and you need more attention for them. That's why those particular regions, say Brazil and all, have more focus on, say, a thigh lift or a thigh lipo or something like that. Now, the thing is, one important thing rather, thigh is a structure which can never be actually put to rest. Like whether you're sitting, you're walking, you're standing, you're doing whatever, your thighs come into picture, because they are very pivotal in your locomotion, in your movement. Even when you're sitting on the back of your thighs and a little bit of your butt. So it's mainly the thighs that you're sitting upon, be it a driving position, be it while watching a movie or whatever. Even when you're lying down, the thighs are in touch with the ground, with the bed. Or when you're standing, the muscles are, again, under a certain tone of, the agonist and antagonist, what we call in muscles, they're under a certain tone. So thigh is never at rest as such. Hence, a thigh lift takes a little longer to settle down. Thigh lift is not like an arm lift where, you can just suspend the arm and you can, give it rest or something like that. Thighs, uh, arms you can rest by not lifting weight, but thighs you cannot rest because they have to lift your own body weight. So the thing is, the thigh is not going to escape its duty at any given point of time. You cannot make it completely relaxed. So that one thing you have to understand, that that's actually a blessing also, because when you start moving those muscles, the vasculature, the blood supply improves across the thigh, and your skin, your fat, and everything starts going into shape better. You can sculpt them out better, faster, by working out leg days. The most dreaded leg days, what generally people hate in the gyms, but yes, they are beneficial, because your hamstrings, your thighs, everything can be toned, and that has to have a particular look. So under thigh contouring, there are like two major subdivisions. One is thigh liposuction and one is thigh lift. Now, the most commonest question is, doctor, do I need a thigh liposuction or do I need a thigh lift? Liposuction, as we all know, is we infiltrate the tissues. That is, we inject a fluid, and then we use a liposuction cannula or a machine attached to a machine to take out the fat. As simple as that. No rocket science there. So one is thigh liposuction and the other is thigh lift. Now, thigh lift usually involves both the procedures put together, liposuction as well as a surgical lift. What that means is you cut the excess skin or the excess tissues and you sew them together in such a way that the thigh looks nice and taut, so that it looks lifted. Hence the word thigh lift. Now you must have observed in your thighs, normally the inner side of the thighs, the upper inner side, tends to sag a little bit, and there is usually a fat deposit in and around the knees. Now the fat deposit in and around the knees is very difficult to correct. It's not that simple, and it needs a good level of mastery over the liposuction and handling of tools as well as expertise of the surgeon. So those two areas, which generally bother, are the most difficult to address. Now the upper inner thighs can have more fat, or they may have just loose skin hanging around. So if you have more fat, you can go in for a liposuction and hope for the skin to retract, or just go back. And if you have more of skin tissue over there, then definitely you will need a surgical lift, wherein you cut out a certain portion of the skin and you stitch it all up so that the thigh gets lifted. So from this, you must have got the gist that if there is more fat in the thigh, if the thigh is very chubby or bulky, then definitely we go in for a debulking liposuction. And a lift may or may not be needed depending upon your age and a lot of other factors, whether your skin has a good retractility, whether it has the tendency to sag, does it have stretch marks. Stretch marks anywhere are a telltale sign that the skin is not going to go back that easily. It's going to put a protest that the skin is already weak, so retraction may or may not be possible in its entirety. So that's what stretch marks tell us. So basically, we decide once when we consult you. Hence, sending photos or videos on digital media platforms is a little difficult for us to analyze, because once we get the feel of the tissues, how much fat is there, how much muscle is there, because sometimes thighs are very muscular and you may feel that they're chubby or they're bulky, but you can't do liposuction in them because they're not having fat. We only suck out fat, we don't suck out your muscles. And some people have very big bones. I can say the bone structure, the framework is inherently big. So there are genetic limitations what we have in individuals when you have a bigger bone structure, or you have a robust, huge musculature, like the ones who live in the hills or mountains. They usually have the habit of trekking up and down the hill to just meet their day-to-day needs. Hence, their leg muscles are going to be much more toned and stronger and bigger than an average sedentary man's thighs. You see a footballer's legs, and they're chiseled, they're unique, they're different. That's because they have been worked out daily to that extent that the muscle is toned and hypertrophic, meaning basically it's more bulked up that way. So that you can't liposuction. Hence, we need a clinical assessment as to how much of fat can we reduce and what is the outcome that generally we would get in this kind of a case. So coming to thigh liposuction only, thigh liposuction has it's a little different type of a liposuction than the conventional lipo, because here we cannot take out all the fat that we desire. Okay, like suppose if it's your tummy tuck and we find a lot of fat over there, definitely we can take out, say, like 95% of the fat and leave some over there so that the skin glides over the underlying muscle. That is very much necessary. You can't take out all the fat from anywhere. Even a neck lipo, for that example, you cannot take out too much fat, otherwise your neck looks skeletonized. It looks like it looks more older. You're doing these procedures to look younger. Don't land up looking older than what you actually are. So hence, a little bit of fat is necessary in all organs, in all tissues, in all places of the body, wherein which will give you a good what I can say, a youthful look to the region that is the liposuction. So thigh lipo, definitely you can't do a lot of it, because the more you take out, you may have a little excess amount of skin that is hanging or sagging, because that fat is connecting the skin to the underlying muscle and the fascia, and it's holding it all together. You disrupt that layer. I mean, not you, we disrupt that layer, and we take out all that fat from there. And then what happens is this skin doesn't get enough time to go and stick to the what I can say, the muscle underneath. And moreover, the skin may not be that retractile to go and do that in thighs. Secondly, thighs are always working. That's why I told all that mumbo jumbo before I started off. Thighs are always working, they're never at rest. So, and you have to wear the pressure garment mandatorily in a thigh lipo. I'll come to that a little later as to why that is really, really necessary. It is really necessary. So, yeah, coming to that. So thigh lipo, now you understood that, we have to, and there are certain regions in the thighs which are called zones of adherence. What that means is basically the thigh is the thigh muscle or the fascia over the muscle is stuck to the skin at certain regions. Like for example, take your hamstrings for that matter. Those who have well-toned thighs will have a skin which is very adherent to the hamstring muscles, and therefore they look well, nice curved. You have a butt, then you have a groove in between, below the butt and between the thighs, segregating it. Then you have a what I can say, a bulge of the hamstrings over there. When fat starts accumulating over there, it obliterates this bulge and also you can't see it. So our aim is to remove that excess fat and make it look what I can say, very youthful and very appealing looking. So a thigh needs a very high level of what I can say understanding of aesthetics when you are doing their liposuction or when they are doing that lift, when they are doing their lift. And all these procedures are under general anesthesia, be it thigh lipo or thigh lift. Spinal is also okay, but then mostly what happens is many patients try to combine thigh lipo with something else or the other. So a thigh lipo can be combined with a tummy tuck, or maybe what I can say, an arm lipo or something, a little bit here and there, because one general notion is that when the thigh is being liposuction, you're taking out so much fat. So, doctor, can you use this fat somewhere else? I said, like, yes, the upper thigh fat is generally good fat. You must have noticed that it's very difficult to burn off the fat from the thighs. It is not that easy. So, thigh fat is normally very resistant, just like the lower tummy fat. So, this fat we can definitely use to harvest somewhere else, like your hip dip correction. So, basically, you take fat out from your thigh itself and put it into the hip dip, which is the outer upper side of the thighs, in women especially, where it goes inside. So that is the hip dip, and then you can give a better hip definition such that you segregate the waist and the hip. So you make so you give an hourglass, that is, you sculpt the waistline and then you give a nice hip, and then you also suction out the thighs. So that gives the lower body a nice definition. That's called liposculpturing. That is beyond liposuction, where you have to selectively remove fat from certain places, leave a little bit of fat there. I'm not saying like suck out total fat and it looks bad. So the thing is, leave certain fat at places where it is necessary, and then do fat grafting at places where a little bit of fat may be needed. So that's thigh lipo for you. And thigh lift can be of various types. Now, nobody likes scars basically. Everybody likes to conceal them. So do we. So in the thigh lift, what we do is the inner side of the thighs, maybe lengthwise or maybe in the groin, somewhere over there, we place an incision to get rid of the excess skin. Now, if you have excess skin in the upper inner thigh, the nick or the cut will lie in the groin. Okay. It will lie in the groin, in the upper thigh only, such that it can get a little bit concealed when you wear, say, a boxer brief or something like that. So that incision cannot be seen outside. Okay, it's well concealed in the groin area, exactly where it lies. So that is the upper medial thigh lift. Then there is the thigh lift in general, or where when we place a long incision along the length of the thigh to get rid of all the extra skin over there. That is when your thigh is generally very large and you're going to do a liposuction, or you're undergone a massive weight loss, massive meaning say 20-30 kg weight loss, and then you have loose tissue there, loose skin, loose soft tissue, and some amount of fat. So you liposuct that some amount of fat, tighten the skin muscles by removing a certain part of the skin and join them all together. So that's what a thigh lift does normally. And I mean, see, if it's just a thigh lipo, you may be able to go home the same day. I cannot predict that very accurately, depending upon the amount of fluid removed, depending upon your pain tolerance. A lot of factors are there into picture. Whether, even if it is so like, your house is on the first floor and you have to climb and go, I will not let you go. I would rather ask you to stay behind in our hospital where, you don't have to climb any stairs or something, because post thigh lipo, you definitely cannot drive for a week or so, or you cannot climb stairs. Maybe one step at a time, baby steps, maybe from day 3 or day 4. But for the first 48 to 72 hours, you have to give it good amount of rest. I would rather say even bed rest. The thing is, when you're lying down in the bed, you have to keep 2 pillows underneath the knees so that the thighs, the blood flow, the reverse flow towards the heart occurs, wherein the swelling will go away. And also you can put 2 pillows underneath your head so that, you get the Fowler's position kind of in the bed, and that gives good amount of relief. So thigh lipo has certain, what I can say, protocols that need to be followed. So before surgery, it is the standard same protocol: no smoking, no alcohol, no smoking, because alcohol will delay the healing, smoking will make it even worse. Smoking is worse than that. So those 2 things. Then blood thinning agents are to be stopped, like vitamin E. Then you have your ginseng. Then you have excessive garlic consumption. All these products which, vitamin E supplements, which promote bleeding, need to be stopped, before your surgery, at least a week or two before the surgery, and of course continue stopping them for another week or so after the surgery. Then don't just resume them as it is. So those are the few precautions. Then you need to, we'll get a custom tailored garment for you, because a pressure garment is paramount after any thigh procedure, be it liposuction or be it a lift or anything of that sort, so that it compresses the thighs very well, and it helps remove the edema fluid faster. Edema means swelling. Okay, so thighs are known to swell really badly because there is a potential space in them to swell. Okay, and the lymphatic drainage is anti-gravity. It is against the gravity basically. So there is an extra effort what the thigh has to do, has to put in. The calf muscles have to pump up the blood. The thighs have to take it all up, and that's how the edema basically gets resolved. So that's about a thigh lipo and a thigh lift. Now coming to the few questions that I have over here. Somebody said hi. Okay, hi too. And one second. What does this mean? Okay, so what are the types of thigh lifts? I already told. So there are like a medial thigh lift, then there's upper inner thigh lift, mini thigh lift, vertical thigh lift, where there is a lot of excess of the skin, and we can take out with an incision on the inner side of the thigh. So nothing is on the outside. Don't worry. All the incisions, all the nicks are always on the inner side of the thighs. There's nothing on the outside. Then can you tighten loose skin? Yes, we can tighten loose skin with a thigh lipo. There is no doubt about it. We can even get rid of excess skin which is there in the thighs. Yeah, coming to the most important question of cellulite. This has been time and again asked to me. Buttock and thighs, whether my cellulite will get reduced if I do a thigh lipo, if I get rid of fat. Now you have to understand that in cellulite, the pathology is totally different. It is not just fat collecting underneath the skin. It is fat in very compacted, pockets. Not exactly even fat. It is lipodystrophic kind of content, which is within the dermis or within the skin itself. So there is a problem which lies at that level, and trust me, diet and lifestyle changes or exercises improve a cellulite. Improve cellulite much better than any other surgical or non-surgical modality available right now. Whether you call it radio frequency, plasma, whatever you use, even surgically, it is not going to get rid of your cellulite that easily. Surgery, liposuction is definitely not a solution for cellulite. In fact, it can get worse. Why? Because cellulite is in the skin. You take out the fat underneath the skin. Now this skin doesn't have support, and it may dimple even more. It may look more uneven. So if it is cellulite that's in your mind and that's creating a problem, definitely liposuction is not the solution to it. Excision of the skin, loose skin, yes, is a possibility when you have extra skin in the thighs where you can take out certain areas and make it look tighter. That is one possibility. But as age advances, again, the thigh skin will grow a little bit, and that cellulitic region will appear. Now, some even ask me, doctor, this liposuction which you did for the thighs, is my fat going to come back? I said, well, yes, nothing in life is permanent. If you don't want it to be permanent, you can, you have to work towards it. It's not like I removed fat once, so it's going to go from there forever. If you're going to consume that kind of a diet, what you're having, which led to the condition in the first place, 90% chances are there that it's going to come back. There's no way to it. Fat does love you the most on planet Earth, and it makes a comeback, and sometimes with a vengeance. So be very careful with your diet and lifestyle post any liposuction procedure. This is not just for thigh lipo or something. It's for any lipo anywhere in the body that the fat can come back, because it gets globally distributed in the body. It's not like, you did the liposuction there, so I'm going to come there itself. No, it is going to come everywhere. It is not biased like human beings. Fat comes wherever genetics have told it to come. Like some people have a pear-shaped body when the thighs are big, so they will always have the tendency to accumulate fat in the thighs. My liposuction is not going to change that. I can only give you a new start, a fresh start, and if you choose to maintain it, well and good. Then there's no doubt about it. I mean, then there's then you can live with that. So how do I get rid of my loose skin? How much extra skin do I need a thigh lift? That I already told. Whether you're a candidate for a thigh lift or a thigh lipo, that I will decide. Because if you have more fat, let's do a lipo. If you have loose skin along with excess fat, let's do a lipo and thigh lift. If you have undergone a massive weight loss and you have only loose skin, let's do a thigh lift directly and not a liposuction anywhere, because you try to avoid a liposuction also wherever possible if it's not necessary. Will thigh lift get rid of cellulite? Definitely not. That's not the answer. That's not the solution. Healthy diet and exercise, yes, it can. Can I have a tummy tuck and thigh lift at the same time? This a mom asked me basically, who wishes to undergo a mommy makeover. Uh, tummy tuck and thigh lift both are not very short. I mean, tummy tuck is a long surgery. Thigh lift is also somewhat a moderate to longish surgery, depending on how much lift is needed to be done. So, or depending on how much tissue is to be removed, how the thighs are, whether you need a liposuction or not. So, surgical time is important. I do not want to operate a cosmetic patient for 8-10 hours under anesthesia, and then that patient wakes up the next day with the tube or something like that. That's not necessary. It's a cosmetic surgery. It's better to give shorter duration of anesthesias for more number of times. You know, you can undergo the second procedure after say 3 months or sometimes 3 weeks, 6 weeks. That is up to me to decide. That we discuss it out together. Like, you know, what is your timeline? What is your time schedule? And let's try to fit in whichever surgery you want the most at the beginning, or in such a way that you're not debilitated or you're not worked up. Like, for example, if you need a chin lipo, arm lipo, breast lift, and a thigh lipo, I'll do the thigh lipo at the last. I will not touch that region of the body which is going to give you, number one, more amount of pain than the other liposuctions and lifts, and which will debilitate you in walking around itself. Like, you know, you do a breast lift, you do an arm liposuction, you can still walk around right from the next day. That's my guarantee to you. But you do a thigh lipo, you need rest at least for the next 2-3 days. There's no doubt about it. So I don't expect you to start running around your home, you know, finding out chores and doing them. That is not what you're supposed to do after a thigh lift. You will need someone probably to take care of you. So thigh lift is a serious business, guys. One has to be very careful with that. And does thigh lift work? Of course, it does work. That's why we do it. Am I the right candidate? Yeah, you are a right candidate if your thighs are bulky, incisions. Yeah, how long does it take for me to recover from a thigh lift? Very commonly asked question. Obviously, it is going to take at least 3-4 weeks, depending upon how much fat is going to be removed. Averagely, we take out about 900 ml, 800 ml, say 1 liter. More than that, usually speaking, 1.5 liter of fat from each thigh. Okay, all areas combined. Maybe the upper outer quadrant, upper outer region where you have a slight bulge. Sometimes some women have it, even men have it. Then you have fat on the inner side of the lower thigh, inner side of the upper thigh, okay, just above and below the zone of adherence in between. So all these regions, you know, when they're liposuctioned, you will need in the sense that will give out about a liter of fat from there. And don't look at thigh lift or thigh liposuction as a weight loss surgery. See, that weight loss is a byproduct that is going to come to your scales couple of weeks or months down the line. That is not our objective. Our objective is to give you a well contoured defined thigh so that it looks good. And can I walk after a thigh lift? Oh yes, you can walk after a thigh lift. Should not be an issue. But in the first 3-4 days at least after the surgery, take good amount of rest. Okay, do not just start jumping around. Don't plan a trekking trip or something like that post thigh lift for at least a month. Thigh lift takes time to settle, guys. Thigh lift or thigh lipo, both of them. It is not something which is like, you know, a very quick procedure. The procedure is quick, but the thing is the results take some time to appear. So be a little patient with that. You'll have to wear the pressure garment for say 6 to 8 weeks. Longer the better, no doubt in that. Helps in good skin contraction and everything goes fine with that. So respect the timeline, take adequate rest, and do not indulge in very strenuous, heavy activities. How long does the swelling last? Swelling in the thigh lift can last even up to say 4 to 5 months. I've seen cases where that has happened, and especially the flabby thighs with a lot of loose skin and a lot of fat has been removed. About 4 to 5 liters of fat has been removed just from both the thighs combined together. Plus, there is liposuction elsewhere, like arms, tummy, and all. Total, I think so. We had done a lipo of about say 9 to 10 liters in that one patient, and that patient's thigh lipo was the last to settle down in the whole spectrum. Everything else settled, arms settled, tummy settled, the chin settled, everything else settled, but the thighs took their own sweet time, and something to the tune of say 3 to 4 months. Because initially there is swelling, then there is induration, that is hard swelling of the tissues, and for that to go with the pressure garment, massage, and everything, it took time. Definitely it takes time. There's no doubt about it. Massaging the thighs after surgery, after any liposuction, massaging should be done at least a week or 10 days, or maybe 2 weeks later. We don't want pain in the tissues when you're massaging. You know, it should be a comfortable affair, not a harrowing thing. Not something like, oh my God, doctor has told me to massage, and you know, it's painful now and things like that. Let the pain settle. Let there be comfort, and then you massage it. It will help you heal faster. So that's that. And um, How long after thigh lift can I exercise? Well, that answer remains standard. It's 4 to 6 weeks. We assess you at say 1 week, 3 weeks, and then we tell you, what you can do, what you cannot do. Yeah, another important question from my overseas clients: can I travel soon after thigh lift surgery? No. After thigh lift or thigh lipo, I would love to have you around for at least 2 weeks. You can plan a trip, plan Kerala tourism, do whatever you wish. That is not a problem. Somewhere nearby you can go, but again, I don't want you to walk or trek for a very long period of time. So take rest, and I need you to be around for at least 2 or 3 weeks. There's no doubt in that. And yeah, the thigh will be a little numb, obviously, following any liposuction. The part of the body is a little numbed out, no doubt, and that takes about a month to recover. Uh, Somebody asked me, is thigh lift painful? Well, it's not exactly painful, but it is discomforting. Let me tell you that. I won't sugarcoat it for you. It's not very, very painful that you can't move a muscle or something, but it is going to be a little troublesome because, as I already said, thighs cannot be given rest. Pain or discomfort reduces when you give certain area a rest. If there's no rest going to be there for that region of the body, then how do you expect that pain will not be there? We do give effective painkillers and all that works really brilliant, but that does not mean that there will be no pain at all whatsoever. Someone asked, what is this? What if I don't want fat removal, just excess saggy skin removal after weight loss, especially in a thigh? So brilliant, you can do that. That's not an issue at all. That's then thigh lift of the third category. First is liposuction, where we take out only fat. Second is liposuction with lift, which probably is not your case, or that I'll have to assess once when I assess clinically, because everyone feels that there's less fat in my thighs and there's no fat and only skin. But we know what to remove, from where to remove, and if at all we have to remove or not. So leave that decision to us. And then, of course, you can cut out certain areas of the skin in an ellipse or some fancy designs, what we generally make. Trust me, plastic surgeons' markings are a piece of art. You must have seen them on Instagram recently, how surgeons mark with different color markers like green, red, black, and all. And the patient looks like a piece of art before the surgery. Well, the whole reason is that the patient should look piece of art after the surgery as well. So these markings are very, very important for us. We ensure that they do not disappear when we clean you inside the operation theater with the solutions. We really, really bank on those markings. So that is also the reason why before and after marking, we take photographs and we keep them in the operation theater, so that by chance, if due to some inadvertent, unseen, unforeseen circumstances, the markings go away, then we can at least retrieve them through the images that we have saved. So I hope that answers your question. Now, is thigh lift painful? What are the scars like in thigh lift? Yes, somebody asked me a very nice question. So it depends on the amount of thigh lift and where it has been done. If it is a groin wala thigh lift, upper inner groin kind of, the incision will be around, will be along the groin crease. So the thing is, nothing will be seen outside if you wear a boxer shorts or a very conservative kind of undergarment. But if it is a vertical thigh lift, wherein there is a long scar along the length of the thigh on the inner side, outer side nothing is visible, but on the inner side you will have a long line, a straight line going on about 15-20 centimeters or maybe longer, depending on how long your thigh is. And then that's the line of closure. So that line will be visible no matter what kind of undergarment or trunk or brief that you wear, because it goes on right near to the knee joint, quite close to it. So definitely one will have to change or wear the clothing according to that. What are the scars like? So these are the two regions where the scars can appear. Then what can I eat? You can eat everything, don't worry, but just be a little conservative with the spices and the oil, basically. So especially during the initial days after the surgery, you don't want to sit puking around because of some spicy food. When can I start driving? Good question. You can start driving or bike riding, say about a week to 10 days later. Normally, that's the time when, one more thing I wanted to tell you here. After thigh liposuction, usually we do not use drains in thigh lipo, but it is gravity dependent. So, fluid is going to ooze out from the lower port sites or the lower incision sites. So those ones we generally leave them open so that they heal on themselves. Until they heal, they keep oozing this fluid out. So in that bargain, you settle down faster. Okay. So what I advise is, be mentally prepared that you're going to ooze a little bit from the lower end of the thighs, wherein some fluid will keep coming out. Blood stained fluid may keep coming out for about 48 hours to 72 hours, and then it settles on its own automatically. So that's that. When can I start driving? Will there be bandages and dressing? Yes, depends. If there is a lift, then definitely there will be. Then when can I resume work after a thigh liposuction or a thigh lift? Generally take a 2-week break period. No argument in that. I don't want to hear the excuse that doctor, I have to go for a wedding next week, or it's my wedding next week and I need a thigh lipo or a thigh lift now, or I'm getting a new job, so I need to fit in, say, a pencil skirt, and I need my thigh this way, that way. So give it time. I need the time for your body to heal. I'm saying I'm no Harry Potter with a magic wand. So that I cannot afford to do. And when can I get a massage after the surgery? Just give it about 2 weeks, let it all settle, let the pain settle, and then you can go about with the massage and all. Well, when will my thighs start feeling normal? That is when will I get sensations? Yes, sensations do take about a month or so to come back, but they do come back. Don't worry, your thighs are not going to stay numb all through the while. And when can I see the final result? Wonderful, lovely question asked. So final result will usually be apparent from any time from, say, 3 months to 6 months. To be very honest, it is like our facial fat grafting. When you grafted fat and nano fat into the face, and you expect a miraculous result because of the fat, you will have to be patient for at least 3 to 6 months. And trust me on this, when we take the pre and post photos, and sometimes the patients claim, to us initially that, "Arey doctor, we did say a nano fat micro needling, or we did something with fat to the face, and it has not improved. It still looks the same." We have the pre and post photos. So the thing is, that makes a very evident display of the result being there, just as in thigh lipo. Initially, with all the infiltration fluid and all, it swells up. Then you do the liposuction, it comes down a little bit. Then again, it swells up and remains so in that dressing till it swells down again. And that period may be up to 3 months, 6 months, depends on how you heal. That's not in our hands entirely. So definitely that will, where was I? Yeah, so the final result will take about 3 to 6 months. There's no doubt in that. There's absolutely no doubt. And then, so yeah, thigh lift and thigh procedures can be combined with a tummy tuck, with a breast lift, or with definitely I wouldn't say with a butt lift, because the thing is, post thigh lipo, you should not be lying down a lot on your tummy or something like that. You should be lying normal, flat. So with a butt lift, you will be expected to lie, on your tummy throughout the time, and then you have done a thigh lipo, then that surface. Why? There's a very simple reason. Nobody does thigh lipo at the back of the thigh, because normally there is never a chance of fat accumulating. It's mainly the front and the sides of the thighs, that get bulky mainly. So those regions, when they're liposuction, you're going to sleep normally flat, so that the non-liposuction area is in contact with the bed, and that gives you relief. Now, if you're going to sleep upside down, imagine the amount of pain that the liposuction area, when pressurized, is going to give you. On top of that, you have got a Brazilian butt lift done on the backside, which is adding to the weight and all. Definitely not a good idea. So one has to be careful in selecting what surgeries to combine and what not to. Does fat come back? Yes, it does come back. It can come back if you're not careful enough. So yes, that is all about thigh lipo, thigh lift, and the various types of lifts, various types of liposuctions of the region, zones of adherence that one has to, as a surgeon, you have to keep that in mind. Cellulitis cannot be addressed. So I just gave you a piece of information in a nutshell in just half an hour. Thigh lipo is a very big topic. Thigh lift is an even bigger topic. We took years to understand and execute those procedures. But this much information, which is like client oriented, I believe you must have got the gist of what I'm trying to tell you. So in case if you have any further queries, please feel free to ask in the comment section, or just like my clients are doing now. But you can ask in the comment section below, or WhatsApp, or chat, or call up, do whatever, just get in touch. Don't harbor misconceptions. See, the aim is not for you to go and get the surgery done. The aim over here with these live sessions and all is to educate, so that you know what to expect, what not to expect, a little bit. Of course, I cannot, an Insta live or a YouTube live does not permit me that much time that I can sit and discuss every little nuance with you. Come down, and your particular problem will be sorted out in your particular way. It's all customizable. Nobody has to follow cookie cutter rule or something like that. Okay, so do keep suggesting me some topics, interesting topics like this, and if I have the expertise to speak on them, definitely I will. So until then, until the next YouTube or Insta live, I'll keep updating. Please keep an eye on my Instagram story section, because that's where, and even the Facebook story, because that's where it mostly gets highlighted or bombarded that there's going to be a YouTube live or something like that. So thank you so much for joining in, and do keep in touch. See you soon. Take care. Bye bye.